So good afternoon and good morning to folks out there on the West Coast. Hello, and welcome to today's event, Ask Me Anything, Stay Sharp for Microplanning for the Flu and COVID-19 Vaccine, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleague, Sarah Price, Deputy Director of Public Health Integration. Before we get started, I would like to review a few housekeeping announcements. You've joined this online event by either physically calling in or using computer audio. All attendee lines have been muted and will be muted for the duration of this event. The duration of this event is approximately 30 minutes, including introductions and obviously a live Q&A. Again, the duration of this event is approximately 30 minutes, including a live Q&A. During today's event, of course, you've submitted some questions in advance, and thank you so much for that. But as questions pop up throughout today's session, please use the Q&A box that's located in the lower right-hand side of your computer screen. You may have to expand that box, but again, it should be visible on your screen right now. Feel free to type your question. Make sure you select to all panelists and hit the send button. Again, you might have to expand that box. Simply type your question in. Make sure you select to all panelists and ensure that you hit the send button to receive that question. Friendly reminders that today's event is being recorded. Attendee lines have been muted for the duration of this event. The Q&A box is located in the lower right-hand side of your screen and will be open for the duration of this event. If we cannot answer your questions in the time allotted or we need additional time to look up some resources for you, we'll post that in our FAQ document after the webinar has been completed. And we have something special for you guys today. Again, this is the fourth in our Ask Me Anything series. You'll be presented with a brief 3-question polling. We're going to announce that shortly, but just kind of gets us with a finger on the pulse of how you've been enjoying things so far. Again, if you would like us to extend the sessions and see if there's anything missing that you need. At this time, I'm going to turn things over to my colleague, Sarah, who'll be introducing our today's speaker and taking it from here. Sarah, the floor is yours.
Hi, thank you so much. Happy New Year, all. We're so glad that you joined us. We hope everyone got through the first week in January okay and safe and healthy. We thank you again for taking some brief time today to join us. We are going to get to your questions, but just want to kind of set the scene a little bit. I'll set the scene on flu, and then we'll have Claire Hannan from the Association of Immunization Managers present a little bit as well. But we first wanted to reiterate a strong point that although there's a major focus, which needs to be on COVID-19 vaccine, that there is still a great opportunity and great importance in getting flu vaccine. We've been speaking with our CDC colleagues almost every day, and we wanted to remind our health center, both our health centers and our networks, that before this flu season happens, there was a pre-order of about 3.6 million free flu doses that could be accessible to each jurisdiction. The map that you see there is how many flu vaccines were allocated for community health centers alone that still need to be used. Next slide, Elizabeth. So what we found is out of 9.3 million flu vaccines that were allocated to all U.S. jurisdictions, and that is for all healthcare entities, not just community health centers. So far, about 117,000, have been ordered by health facilities between August and December 2020. That is with community health centers alone, which means I know that math doesn't completely add up. There's a lot of other things there, but just so you know, there's about 6.8 million doses still available of flu vaccine, upwards of upwards of about 2 million available to community health centers. So what we want to do is get to the point and say, health centers, if you need more flu vaccine, please contact your local or state health department and immunization managers to ask for doses. We've had some conversations with folks waiting to get flu vaccine, from the manufacturers or order those. Please continue to contact your immunization manager. The website is listed below on how you can contact them by state or jurisdiction if needed. And also for networks, we know that there are networks also on here. Please spread the word to your health centers about the access for these flu doses and help to facilitate the communication with the health department and immunization managers. We don't want any of these flu doses to go to waste. We want to make sure that we still prevent a twindemic and that anyone who still needs a flu vaccine is able to get that readily, and health centers are able to be supported by that. So that is my big flu message today. I want to move on to Claire quickly, as she is our Ask Me Anything expert. Next slide, real quick. So Claire Hannan is with the Association of Immunization Managers. So she is our spearheading a lot of the work and working with the immunization managers on both flu and COVID. She is going to do a little scene setting for us since we haven't had a webinar in a couple weeks. While she is doing that, I want to remind everyone we have some poll questions you'll see on the right-hand side of your screen that'll help us inform the content of our future sessions. So just take a quick minute to fill those out. That would be wonderful. And then please go ahead and start streaming in any questions that you have under the Q&A box. And we'll get to those as soon as Claire is done sharing. So Claire, welcome. Happy New Year. Take it away.
Thanks so much, Sarah. Happy New Year to everyone. And, you know, just a big thank you, a reminder of how much you guys are doing, getting flu doses out, and now being, you know, getting COVID doses out as well. It's just tremendous, and I can't thank you guys enough. I know from all of us in the immunization community and public health, we're all one together and just appreciate everything being done. I just wanted to give a kind of overview of where we are and kind of level set before we go into the questions. So, you know, the phase 1A is ongoing, focused on healthcare workers and long-term care facilities. And again, how that works is that every week, state public health agencies get an allocation of doses, either Pfizer, well, both Pfizer and Moderna. They get that generally on Tuesday. It gets loaded into the ordering system, the VTRAC system, on Thursday. And then they put orders in. They spread those doses across all of their enrolled providers. And for phase 1A, focusing on those providers that serve healthcare workers. So really trying to spread those doses. They don't get enough doses to send to every provider that serves healthcare workers. There has been a focus on, you know, sending it to providers who serve healthcare workers. And the other piece of it, the long-term care facility, a big piece of what's allocated to them gets set aside for CVS and Walgreens to go into long-term care facilities and vaccinate. So how's it going? You've probably seen the media reports that, you know, look at the CDC tracker and say, you know, what's going wrong? Why aren't doses going out? And the tracker right now shows 21.4 million doses distributed and 5.9 million doses into arms. And, you know, that does look like a huge difference. I just wanted to make a few comments on why that is and what is being done about it. So a couple of things contribute to that. One is, as I mentioned, the long-term care facility, a huge bolus of those doses, almost 4 million, have been set aside for CVS and Walgreens, and they've vaccinated about 600,000. You know, we did also have a couple of weeks with holidays. This is really the first week where we're seeing those shipments coming in Monday, Tuesday, Wednesday, and actually having the Thursday, Friday, Saturday to vaccinate. And then even in a perfect situation, we're going to be 6 million doses or so behind. Well, not behind. There would always be a gap because you have doses being shipped out, arriving Monday, Tuesday, Wednesday, going into arms Wednesday, Thursday, Friday, Saturday, then up to 72 hours being reported to CDC through the states. But meanwhile, on that Thursday, you have a whole nother bolus of 6 million doses, 5 million doses being ordered. So, you know, the shelf gets stocked, stuff is going out, but it doesn't match one-to-one. So I don't think we need to sort of push the alarm button because there are so many doses showing in the tracker. Obviously, we need to really look at where the doses are going and if there are challenges in getting them into arms, addressing that. And I think what we're hearing from our members is that, those who are getting the doses are scheduling them, giving them out. They're moving at a conservative pace. They're getting a lot of questions from healthcare workers. They're trying to answer them. They're scheduling healthcare workers. They're staggering. They may be focusing on frontline staff and waiting for other staff. We do see some states opening it up to a larger phase, to the phase B, to over 65 or over 75 earlier than others. And that's simply, a reaction to wanting to get the doses out into arms. So it doesn't mean they're going to stop vaccinating healthcare workers. It just means that they're taking advantage of some demand where it is, getting doses into arms. We need to stay focused that doses are going to continue to come every week, and we're going to continue to put them into arms. And there may be different rates at which states open vaccination up to larger populations, but we will get there. Obviously, the plans for 1B, 1C involve much more activity with public health, some larger scale clinics. At this point, just the big challenge is waiting for that funding to come, and it should be coming soon. And also, hopefully we'll see production go like that. Right now, we just have the allocations going like this, and states don't actually know their allocation week to week what they're getting, so they can't really plan a big phase out, a big scale up. So that's where we are. And I will say one more thing is that the CDC is opening up the retail pharmacy program. So this is a program that will allow states, if they want to, give some of their allocation to retail pharmacies. They can do that. And I think for some states that will help. For others, they just don't have the supply to spread across wider providers. They're probably going to have a more focused approach. So we'll have to see how that works. But I think I'll stop there and we can open it up for questions.
Thank you so much, Claire. Thanks for that great information. I think revisiting this topic and seeing, where we are, especially after the holidays, I think it's, very front of mind for folks. We know that our healthcare workers never really stop for the holidays. So I appreciate you kind of level setting with us.
Right. Important point there, too, is that the healthcare workers are working around the clock and they're spread very thin. And it's really difficult to vaccinate everybody all on one day. It just doesn't work like that.
Yeah, no, absolutely, absolutely. Just as a reminder for our participants, go ahead and put questions in as they arise. No question is too tough. Again, we'll defer any question that we feel like we can't really answer, but we'll get back to you afterwards. One question that we actually got ahead of time is really focused on staff vaccination, which we know is the key here. And so I'm actually going to combine it with another comment that we just got. So there seems to be, difficulty in kind of planning this staff vaccination. We've heard that sometimes there's, contract employees that were not necessarily included in the original, numbers of that organization, or part-timers. We're just getting a comment today about sick COVID staff. They have staff that's out that's, that they didn't necessarily plan, they plan for a vaccine now, but not for later. Have you heard or seen any kind of best practices to continue in trying to get staff vaccinated, or, kind of any other resources that you know about there of best practices? I mean, this is something we may revisit on future webinars as well. We'll have a health center talk about that.
So, and I mean, this is me, and my advice is to get the vaccine out. If someone doesn't want to get their first dose because they're not going to be, they can't know exactly where they're going to be when the second dose comes around, give them the first dose. If someone says, you know, I don't know, maybe I'll come back next week, then vaccinate the next person. And hopefully you're going to get more doses and you can vaccinate that person next week. Continue to encourage vaccination, Ask them to read about the contraindications. You know, if they have a cold, they can still get the vaccine. If they're not, you know, if they have COVID, obviously they have COVID. But you really need to get the doses out, and you don't need to make the perfect the enemy of the good. The vaccine getting into arms is what we really need. And I know that it's very, very difficult to get a certain number of doses, to try to be targeting one group and to not know when you're going to get your next set of doses. So should I use this dose here or there? I think when you have to make judgment calls, getting the vaccine in the arm is the way to go. As you're getting questions and as these situations come up and you're not sure what to do and how to handle them, definitely send them on, and we send them on to CDC. I think this is the kind of feedback they need to know. They are working on educational pieces. They are working on a National Ad Council campaign. And so knowing the kind of questions that are coming, the kind of concerns, the kind of issues we've heard that, you know, there's been this myth about the vaccine causing sterility. We do have some information put together on that. As these situations you're encountering, yeah, definitely pass them forward, but get vaccine into arms as much as you can.
Absolutely. That is the message loud and clear. Thanks, Claire. Well, just one quick admin question. Can you restate the number of doses that have been distributed and in the ARM system?
Oh, yeah. So there's a COVID vaccine tracker on the CDC website, and they have cases and they have vaccinations. If you click on the vaccination one, there's a box for total doses distributed. It's currently at 21.4 million. And there's a box for total number of people initiating vaccination. It's currently at 5.9 million. This is what a lot of media have jumped on. The media have really been pounding the governors, the state immunization programs, the state public health agencies. And, you know, we're just doing the best we can to explain why there's, you know, such a difference there. But it's on the CDC website. There are a couple of other sites. The Bloomberg has a site, and it's tracking by state. And I think Johns Hopkins, New York Times also have tracking sites. Honestly, there's no perfect system to really capture what's going on. And because vaccines coming out every week, there's always going to be, you know, a bolus there. And, you know, we just want to keep it as small as possible and get doses in arms as quickly as possible.
Excellent. Thank you, Claire. Looking ahead, we have one question about what are some top areas of focus for health centers planning ahead to set up mass vaccination clinics? And I would add, what are some best practices to work with their public health departments or immunization managers in order to kind of plan ahead for that mass vaccination if they feel they can take on?
Well, you need to make sure you've got something to manage demand. You know, we've seen what's happening in Florida with people waiting in line overnight because their system, you know, wasn't allowing scheduling. So you need to make sure you've got a scheduling system. You've got a way to manage demand. You've got to put out information ahead of time, you know, as far as what to expect. So people know what to expect. You know, if you say you're going to vaccinate and you only have 25 doses and you're putting out that you're vaccinating and there's thousands of people going to see that, you know, you can imagine what's happening. So make sure you have a system to manage demand, to schedule appointments. You've also got to really look at the throughput and plan for that. So it takes a lot longer with COVID vaccine. You need people to answer questions. There are more questions being asked. And you need to have that observation period, really critical with some anaphylactic reactions, that you have that observation period and you're prepared if something happens there. So we do have some some examples of scheduling apps and ways to manage demand. There's a COVID Ready, there's a Prep Mod, there's a Real Solutions app that New Mexico is using. There are some things out there, but that's definitely something you want to have in place in your communication strategy, and just plan on having extra staff, because it just seems like things, the throughput is not, it's not anything like flu vaccine.
Correct. And we've been hearing a lot of stories from health centers about that very thing, about being creative with staffing, with scheduling, and prepping that. And again, I think in our future sessions, we'll have a few health centers on to be able to talk about, the kind of their experience in planning, and especially about setting, their staff up ahead of, but also planning as well. Can you talk a little bit, Claire, going back to the either the myths or the hesitancy? Sometimes we're not sure if it's hesitancy based on myth or hesitancy, based on kind of just waiting to see how things happen. Can you talk a little bit about what you've been hearing, from the field about addressing hesitancy or more myth busting as well?
Yeah, and one thing I would add too is that you don't want to hold back doses for the second dose. Don't do that. Give doses out. Currently, doses are being held back for the second dose already at the CDC level. Even if that policy changes, you'll be able to order second doses. So don't hold those back. Yeah, with regard to the hesitancy, we've had some conversation. We had some conversation with our executive committee about this yesterday, and I think what they're hearing anecdotally, and we don't have sort of the data in real time to see, but that is some healthcare workers have trust and confidence in the vaccine. They're like, give it to me, and they sign up right away. Others, maybe not necessarily hesitant, but more, let me know more about it. They don't have that trust right away. They need to see the information. They want to digest it. They're saying, well, I'll go next week. I'll go, you guys get these people first. And then there's, maybe another section that really have issues. They've heard about, the vaccine causes sterility. They've heard about this or they've heard about that. Those are the ones that you really want to provide the information for. Vaccinate Your Family is putting together information on myths, putting information together. Those are the people that you really need to refer for more information. Tell them to talk to their, if they have issues or concerns, tell them where to go. These sites like Children's Hospital of Philadelphia, where they explain the vaccine. But it's that middle group that really is not hesitant, but they don't have the trust or confidence that some other people have. And what we're hearing is it's also, it's white people that have this confidence and trust. And it's maybe the minority communities that don't. And so we don't want to end up vaccinating all the white people, right? That's, and not what we want to do. So that group, it maybe just takes a little bit more engagement and a little bit more listening to them, providing some information and assuring them, okay, you can vaccinate tomorrow, or we don't. I'm not sure how to say. I'm not sure there's all the solutions, but I think that what we're hearing from our members is there's it's something other than just hesitancy. It's a new vaccine. The confidence, the trust is building, but it's maybe not automatic. So talk to them yourself with confidence. Show them people are getting vaccinated. Healthcare workers are posting this. This we're in an epidemic. There's no reason not to trust the vaccine. Here's why. It's safe. It's effective. All those kinds of things. And I think just reassuring them, that's really all they need. They don't need, an education course. Now, there are some that have these specific concerns that you need to address. But really just being confident yourself and recommending it and saying, you should get it. It's here. and this is, you know, it's effective, it's safe, and this is your opportunity to get it.
Absolutely. Thank you, Claire. And we've seen so many Facebook posts, we've seen Instagram, we've seen news articles about, the beauty of that picture of people getting their shots, right? And I think that's been such a great movement, to share with that. We have one more question and then we'll end. Do you have any insights on the effectiveness of the vaccine with a new variant of the virus? And if not, we can also defer that question, but if you happen to have that answer.
That is a really good question, and I've seen a couple of different things. Obviously, there's no conclusive evidence anywhere, but Dr. Fauci does have confidence that the vaccine will cover the new variant. So, I think we don't know everything about it. But at this point, there's every reason to believe the vaccine will work. So, I think that's where we are. And if you want to have information on that, I think you can. I think Dr. Fauci has made comments on that. And, that's what you can share. This is what we know. This is what we don't know. We don't know everything, but we do believe that the vaccine will be effective there.
Great. Thank you, Claire. That is all the time we have for questions. Right now, I just want to follow up with a few next steps. If you have not taken the poll yet, that's on the right-hand side of your screen. Please go ahead and take that. Again, we want to make sure that our future sessions, there should be at least 3 more, can answer those questions. But let me just remind you of a few other things. Again, we're here Fridays from 12 to 12:30. We'll see you all next week on the next one. For this, like I said, we'll be having some other guest speakers, either from CDC or from health centers to kind of comment on other contact as well. We will always have Claire as well. We do have a website or a web page up on the NAC website devoted directly to COVID-19. So you'll find a lot of different resources there, a lot of different topics. And we're trying to cover everything from financing to workforce to clinical protocols and kind of a clearinghouse, if you will, that we update on a very regular basis. And it also includes recordings from these sessions as well. So if you missed any, you're able to get that. I always also encourage you to check out the Association of Immunization Managers website. If you don't know who to contact or just need additional information, they have a great website as well. That's immunizationmanagers.org, O-R-G. Never hesitate to reach out to me. I'm happy to triage any questions for either the immunization managers or NAC. Like I said, we communicate regularly with Claire and her team as well as CDC. So you can also email fprice@nacnachc.org on that. I think that's all the time we have for today. We'll stay on for additional minutes. Any other closing remarks, Claire, before we head out?
I guess my closing remarks are stay motivated. Vaccine is going into arms. Get that flu vaccine out too, and just stay motivated. Keep up the good work.
Excellent, Claire. Thank you all so much for your time. We look forward to seeing you all again next Friday at 12 noon. Have a great day.
So much,
again,
Sarah.
Happy New Year. Thank you, Claire.